Welcome to Learn and Go with Laurie at Optimum Pet Vitality. We're continuing our Optimum Laser Outcome Miniseries. Last time we talked, my goal for you was to make more patients feel better faster. I want more. I also want better job satisfaction for you. Having better outcomes makes you more valuable to your company and your clients. I have clients drive hours to come see me, and I want that for you too. I also want you to have the knowledge to feel challenged to improve your outcomes with each case rather than laser complacency. Optimum treatment is more than just point, shoot, and hope. If you're enjoying this mini-series, I'm releasing a robust course on all of my laser information, including research, protocols for multiple lasers, and my special tips, tricks, and trade secrets for optimal results with any laser. Today, we're going to look at using laser therapy to aid in building muscle strength, endurance, and power. Sorry, this doesn't replace exercise, it just adds to it.
Our sponsor for this session is SpectraVet Lasers.
We always start by asking, what's our goal? It would be nice if our goal could be to enhance the muscle's ability to build strength, endurance, and agility, as defined by the ability to rapidly change the position of the entire body in space with speed and accuracy. But we may have to choose. Let's start by looking at what lasers can do. We know lasers, when used with a workout, can delay fatigue so you can work out longer. They allow for less oxidative stress to the muscles in a workout. They burn a higher percentage of body fat. Woohoo! They increase maximum voluntary contraction, which is power. They increase the rate of building muscle mass. They decrease muscle soreness after exercise, and they change our VO2 max. Multiradiance has done some research in human high-performing CrossFit athletes. They showed some surprising statistics, and we're going to talk about that in detail in the course. But for now, some of the conclusions were, if the goal is to build strength, it's best to laser before and after the exercise. If the goal is to build endurance, it's better to laser only before exercising. And if the goal is to improve power and agility, it's best to laser only after the exercise. So we need to decide our goal, strength, endurance, or agility, and know that we can change this goal each day that we work out with our dog. Why does this matter to you? What's the relevance? Besides just working with the patients you have now, you could start a fitness club Sundays before or after regular hours, and you can have added income and clientele. Remember, this is not only for athletes. There could be a geriatric class, a young adult class, an athlete class, or even a class for postoperative cruciate patients, if that's something your clinic specializes in. The thing we need to consider is we want to laser the muscles that the dog is going to be targeting during the workout. If I go running, even though I'm swinging my arms, it's my quadriceps, my hamstrings, and my calf muscles that are my target tissue. If I'm working on balance and proprioception, I would consider treating my dog's trunk. If I'm working with mushing dogs, I would consider treating the muscles of propulsion. Whereas if I'm treating agility dogs, I would treat both the muscles of propulsion and deceleration. When working with police dogs that are going to be doing bite work, I would consider the muscles of propulsion and the neck to be my priority. Lastly, but importantly, we don't want to laser an area to mask the pain and then ask the dog to work out and potentially create a larger injury. So, why do we do this? Because stronger and pain-free life means better quality of life, happier clients, and happier pets. All right, let's look at our muscle anatomy. We'll start with the back leg. We want to work on our muscles of propulsion. So we start with our gluteal muscles, and then this is the lateral aspect. Coming down, our most lateral muscle is the biceps femoris. Now, if we look on the inside, we have our gracilis. And you don't need to know all the names. You need to know where they are. And having colors and pictures helps you remember where they are so you know where to treat with your laser. If we were to take the gracilis off, remember that's our hard-boiled egg muscle, really common to get trigger points, and I've seen him even torn a couple times. If we were to take him off, then I would get my semimembranosus and semitendinosus. Again, all the muscles caudal to the femur, where we're going. Below the knee, we're going to get our calf muscle, or gastrocnemius. He can get torn off the top, he can get torn at the bottom. We definitely want to work with him. When we go to the trunk and the front leg, this is what we see. Now, it's really easy to remember the paraspinal muscles, para next to spine, the spine. But what I do want to add is the iliocostalis. He's a muscle that I see trigger points in all the time. Here's my ilium. So from the ilium, iliocosto, to the ribs is where he runs. In the front end are our muscles of deceleration, really important. The biggest, most important muscle is the tricep. I've seen tears and trigger points, oh my gosh, constantly. He runs from the scapula to the point of the shoulder to the point of the elbow. So he makes a triangle, triceps, important. Down the back of the front leg, the forelimb flexors come from the elbow to the wrist. That's our hyperextension injury to our forelimb flexors. We treat him, again, I can see trigger points and all kinds of things that make me want to get him strong and less likely to get injured. So that's the anatomy we need to look at for muscle strengthening. Now let's look at the dog. My recommendation would be for you to go get a dog and bring him back, and this way you can palpate with me as I go through. If I'm working with a dog that has neck issues, what I want to think about is treating the trapezius, the splenius, the rhomboids. All you really need to know is if I go from the ear to the point of the shoulder and up to midline, so there's a line right there, I want to get those muscles. You're going to get everything you need to know. If I'm doing a front end workout, so I want to work on the muscles of deceleration, I'm going to get the triceps. He's my most important muscle. He is going to come from the olecranon, so up the elbow, all the way to the scapula. You can feel his edges coming to the point of the shoulder, so it's actually a triangle. And then for the forelimb, we're going to come underneath here. So again, from the olecranon, but now we're going down. We're going to come down to my carpal pad or my accessory carpal bone. Those are my forelimb flexors. So with those two, we can get our front end exercises. If I'm working on the paraspinal muscle, sit up, there we go, and sit. If I come from dorsal midline, I can come down and I can feel where those muscles end. My transverse spinalis system, my longissimus. We follow that all the way down until we get to the end of the ribs, and then we're going to add iliocostalis. And up. So here's the wing of my ilium. So ilium, costo, ribs. So we're going to not only laser up here, but we're going to come down on the side all the way down to the end. If I'm working on a high-end athlete or a iliopsoas injury, I'm also going to get him, but that's a lecture for another day. If I'm doing a rear end workout, I want to get the gluteal muscles, really important. So here again, my wing of my ilium. If I follow that down, it comes to my greater trochanter, but I don't want to just get my middle gluteal. I want to go above that, my fan-shaped superficial gluteal, and then I want to get my hamstring, so all the muscles in the back end. I've got my biceps femoris, my semitendinosus, my semimembranosus. Most important would be my biceps femoris, my semitendinosus, because he comes down to the tibia. And then the most important muscle in the back end would be the gracilis. He's the most injured muscle I see in the dog. So if we put him, hi Sid, I got you. He's my little hard-boiled egg muscle. So if you can see in here, right in there, you want to make sure you get him. As I come down the leg, you can just think calf muscle. So I'm going to get my gastrocnemius, my superficial deep digital flexor, by coming around this way. And I can come all the way down to my tuber calcanei. So I'm getting my common calcaneal tendon because I don't want him to tear. It's always good to help him.
In this session, I will show you how I would treat this with a SpectraVet Pro 2, which has varying levels of power depending upon the probe you attach. I also want to mention that there's a SpectraVet Zeus, which is another affordable option that you can use with the same probes, but you don't have the ability to change the frequency. Now, the first three probe options are a 904 nanometer wavelength multi-diode probe with either 4 diodes, 100 watts of peak power, 12 diodes with 300 watts of peak power, or 24 diodes with 600 watts of peak power. From there, we move to the 810 nanometer probes with either one diode with a convex lens that can come with 500 milliwatts, 750 milliwatts, or 1 watt of power, allowing you to decide if you want a Class 3B or a Class 4 laser. Besides the one diode 810 nanometer probe, you can choose a 4 diode probe with either 1 watt, 2 watts, 3 watts, or 4 watts of power. The next set of probe choices include a dental probe with a curved tip for better access into the mouth, available in either 810 nanometer 100 milliwatt analgesic diode, a 405 nanometer 100 milliwatt antibacterial diode, or a 605 nanometer 100 milliwatt wound healing diode. The last set of choices are specifically designed for acupuncture treatments, with a diode with a small aperture to allow for precise acupuncture point stimulation. These include an 810 nanometer 250 milliwatt continuous wave probe or a 650 nanometer 100 milliwatt continuous probe. Now, in case you don't have the same laser, don't worry. In just a minute, I'll give you directions that may suit you more. To start the SpectraVet Pro 2, insert the key and turn it 90 degrees clockwise. 2 beeps will be emitted, and the green standby, frequency, duration, and battery lights will glow. After the 2 beeps, the standby light will extinguish and the amber ready light will glow. At this point, the probe that is attached to the base will be ready to use with the previously used settings. If you'd like to change the settings for the SpectraVet Pro 2, simply press the blue Ready Standby button, which will place the laser into standby mode. The amber ready light will extinguish and the green standby light will glow. In this position, you can change the laser frequency and probe duration time for each position that you're going to set. We can set the frequency and duration with the up and down arrows below each set of lights. Once these are set, the blue Ready Standby light can be pressed again, and in a few seconds, the amber Ready light will glow. The new settings will be saved to memory, and you're ready to treat your patient. At any point while the base is on standby, the probes can be interchanged. Put it on standby. Change our probes. There we go. Put it on ready. So we can change our probes. Each probe has a button that can be pressed once to turn the laser diode on and again to shut it off. The probe will shut itself off at the time interval set on the base. To start the laser again, simply press the button. Now the probes with multiple diodes, like this one, have a light around the button which will flash when the probe is emitting laser energy. The frequency and duration lights will also flash when the probe is emitting laser energy. At any point while the laser probe is emitting energy, the red safety stop button can be pressed to immediately discontinue the emission and place the base on standby. When treatment is complete, turn the key 90 degrees counterclockwise and it'll shut the machine off. Now let's treat the dog. Let's look at the hand and probe position to treat the patient. Remember, laser therapy won't strengthen the musculoskeletal tissue directly. However, post-exercise laser treatment can play an important role in accelerating muscle recovery, reducing pain, and improving post-exercise muscle performance and function. When used to precondition the muscle tissues, laser therapy can increase function, delay the time to fatigue, protect muscle tissue from primary and secondary exercise-induced damage, and promote post-exercise recovery. We do not need to treat every inch of the muscle. It would be nice to treat some of each muscle, but remember, one muscle cell equals one muscle fiber that runs the length of the muscle, so treating somewhere in the muscle benefits the whole fiber. Remember, in the human studies, they treated a whole human leg with only 17 points, and that included the quadriceps, sartorius, the hamstrings, and the calf muscles. Our patients have much less surface area of muscle. If there are several competitions in one day, I would recommend treating before the day starts and after the last event for muscle strengthening and endurance. But I would treat the muscles during the event if there's spasm, trigger points, cramping, or excessive tightening. To know if these are present, I recommend checking the muscles between events. The research I found said for endurance, it was better to laser before and after training or competing. And for strength training, it's best to laser just before the exercise. As these are single studies, more information should be forthcoming. Start by palpating the muscles that will be working the hardest during the dog's workout and look for excessive tightening and trigger points. I would treat these areas first and then treat the rest of the muscle with a small amount of energy. Remember, the optimum amount of energy delivered will depend upon the wavelength you're using. This is a place where having a large probe is beneficial. It allows you to treat a larger area at one time. For treating muscles before and or after exercise with a SpectraVet laser, I would use the exact same protocol before and after. I would use either the 810 2000L multi-probe with my Pro 2 set to 10 Hz or my 9600S P12 multi with my Pro 2 set to continuous wave. Before exercising, I would treat each area for 30 to 90 seconds, depending upon the size of the patient. After exercise, I would repeat this, and then with the same probes and settings, treat the draining lymph nodes. So we're doing front leg, with the axillary, we can get popliteal, we can get inguinal. We would treat each lymph node for 60 seconds. If there were trigger points, I would treat them with the 810 2000L multi-probe or the 810 500 deep with the Pro 2 set to continuous wave. Each point would receive 30 to 60 seconds of treatment depending on the size of the dog and the size of the trigger point. If the point is still reactive after treatment, this can be repeated for up to a total of 3 sessions. Treatments can include the lateral aspect of the neck, especially if the dog is going to work on weave poles or swimming. Treating the muscles on either side of the spine is beneficial if the dog will be doing endurance work, long or fast runs, playing frisbee, agility, anything that will ask them to use these muscles. If the dog is going to be running full out, especially if the dogs extend their spine when running, like border collies, or if they've had iliopsoas issues in the past, I would put a bit of energy into the psoas group. If the aorta happened to get some of the energy and the heme carried that energy to the rest of the body, that would be a bonus. Treating the triceps, bicep brachii, and forelimb flexors are beneficial when the dog will be braking or decelerating, making sharp turns, and jumping, as well as if they're doing a lot of running. As the rear limbs are responsible for acceleration and drive of the dog, treating the gluteal muscle, so middle gluteal, superficial gluteal, and the hamstrings, biceps femoris, semitendinosus and semimembranosus, coming in and getting the gracilis, as well as the calf muscles, or gastrocnemius. These are my primary targets for helping them push. If you have time, treating the sartorius, tensor fascia lata, and quadriceps femoris is also beneficial, as these are the hip flexors, especially if the dog is going to be doing trail running or something that is going to make it need to flex their hips. That's what these guys do. If I had a respond laser, I would use a 904 nanometer super pulse probe for the large areas of the small dog and most of the big dog. I would treat it with 1 to 2 joules per centimeter squared on all of the target muscle areas. For smaller muscle areas on small dogs, I would use the 808 nanometer continuous wave probe at 1000 milliwatts, 1 watt, for light skinned dogs, or 500 milliwatts for dark skinned dogs or coated dogs. And I would use 3 joules per centimeter squared, targeting the core muscle groups. Big picture concept. You use significantly less energy when you're using a 904 or 905 nanometer wavelength compared to a wavelength in the 800 nanometer range. If I was treating with a companion laser less than 12 hours before the competition or immediately after a competition, and there was no major issues, but I was trying to prepare the dog for his best performance, I would use 8 to 10 joules per centimeter squared, focusing on large muscle groups around the shoulders, hips, and down the spine. Of course, if there are trigger points, areas of pain or spasm, I would focus on those areas specifically using a higher fluence, around 10 to 20 joules per centimeter squared. Now, it's worth noting that for some dogs, the laser can feel so good and be so relaxing that the patient is too relaxed. This should be discussed with the owner. For all situations, use a large contact head for the larger muscle groups and use a small contact head for smaller dogs or smaller muscles or areas being treated. Remember not to go above 5 watts when you're using the small contact head. One last thought. If you have weak or elderly patients where there's less muscle to absorb the energy and or less blood flow to deliver it to the rest of the body, or there is minimal body fat to transmit through, reduce the time or energy that you're delivering by 20 to 30%. You can play with the numbers and see what works best for your patients. You may even want to experiment with one body part at a time. Get a feel for what helps performance and then move to the next body part. Remember that some of the energy is going systemically through the blood. So you may find the perfect amount of energy for each body part, and then when you put it all together, you may need to decrease this slightly. All right. Thank you again to SpectraVet for sponsoring Optimum Pet Vitality and supplying a laser for us to show you how to use laser therapy to aid in strengthening the muscles.
Added tips for today. Keep blank calendars on hand and set up a calendar for your clients telling them what to do and how often and how much time to spend on it. Make it realistic for them. If it's too much work, they won't do anything. Give at least 1 to 2 days off per week with no forced exercise, but remember, play and walks are always fun. Make sure your clients know that too much exercise actually increases the chance of injury. I hope you had fun. I hope you learned something. Don't forget, join the waitlist right now by following the link in the post. You'll receive information about our Optimum Laser Therapy course before anyone else. You'll receive an invitation to a private webinar with me on laser therapy. Plus, you'll receive early opportunities to enroll in the course with bonus content that no one else will receive. I'm Laurie McCauley at Optimum Pet Vitality. Thanks for joining me with Learn and Go with Laurie. Take care.